Here's some notes on neonatal lung function compared to older children and adults. There are some structural differences in neonatal lungs that lead to functional differences. Neonatal lungs have a more pliable rib cage. This causes retractions, which leads to less efficient gas exchange, which can result in increased work of breathing. During inspiration, the adult's rigid chest wall provides a stable framework against which the diaphragm can pull to create negative pressure. In neonates, on the other hand, the chest wall is more pliable, so the wall gets pulled inward, called retractions, instead of helping create the negative pressure. This leads to less effective negative pressure generation. This is similar to when you're trying to drink from a rigid versus a very soft straw. If you have a rigid straw, you can get good suction because the walls stay firm, whereas a soft straw will collapse inward, making it harder to get the liquid up when you suck and create that negative pressure. The muscle composition is also different in neonates. In the diaphragm of a neonate, only 25% of it is type 1 fibers, which remember are the slow twitch, high-oxidative fibers. This is in comparison to 55% in adults. This means that neonates are more prone to fatigue. The type 2 or fast twitch fibers fatigue faster, but they're more useful for short, powerful movement bursts. The intercostal muscles are poorly developed in neonates. The diaphragm becomes the primary muscle for respiration, and of course it's still the primary muscle for respiration in adults as well. It's just even more prominent in neonates. There are also some compliance differences. The chest wall is more compliant than in adults. The lungs themselves are less compliant than in adults. These opposing forces affect breathing mechanics. A pliable chest wall with lower lung compliance leads to functional airway closure and increased work of breathing.